Welcome back to Medicare Unscripted. I'm Kaylee Terpovich, Director of Medicare Operations at Secure Money Health. On this podcast, I break down real Medicare situations, common mistakes, and what you actually need to understand so you can make confident decisions about your healthcare coverage. Because when it comes to Medicare, one of the biggest misunderstandings isn't what it covers, it's what people assume it will cover long term. And that's where families get caught off guard. So let's get into it. Let's start with a real life scenario to put this into perspective. Imagine you book a beautiful hotel for a weekend getaway. Breakfast is included, housekeeping is included, you have pool access, everything feels covered. Then, on the third day, after you are having such a great time, you decide you want to extend your stay. You go down to the front desk and they tell you, well, that's a different rate. That's not included. And suddenly, everything changes. That situation, that's exactly how families experience Medicare when a loved one needs extended care. They assume nursing home care is covered. But it's not, at least not the way most people think. Medicare will cover short-term skilled care, but only under very specific conditions. And when that period ends, that's when the financial reality hits. So let's break down what that actually means when it comes to Medicare. Medicare is very specific about what it covers. It covers skilled nursing care, not custodial care. And that distinction is everything. Skilled nursing care is medical. It involves licensed professionals and is focused on recovery. This can include things like physical therapy after surgery, wound care, IV treatments, monitoring medical conditions. And for Medicare to cover it, the care has to be medically necessary, ordered by a doctor, provided in a certified facility, and there are other strict requirements. There typically must be a qualifying inpatient hospital stay of at least 3 days. Then, if approved, coverage works like this. Days 1 to 20 generally are covered in full. Days 21 through 100 requires a daily coinsurance. And after 100 days, Medicare stops paying completely. And here's the part that surprises people. Coverage can end even sooner if the patient stops improving, because Medicare is not paying for the stay, it's paying for progress. Now let's contrast that with custodial care. Custodial care is help with daily living, things such as bathing, dressing, eating, moving around safely, supervision for memory issues. This is long-term support, and Medicare does not cover it. So when rehab ends and someone still needs help living safely, that's when families are faced with private pay, long-term care insurance if they have it, or Medicaid planning. And that's when the hotel rate changes. This is where a lot of misconceptions come in, so let's do a quick game of myth or mistake. Here it is. Medicare will pay for my nursing home if I can't live alone anymore. That is a mistake. Medicare pays for short-term rehabilitation. It does not pay for long-term living assistance. And this is one of the most common and costly misunderstandings in retirement planning. Now let's talk about why this matters even more today. Long-term care costs are rising. The average cost of assisted living and skilled nursing continues to increase every single year. At the same time, people are living longer, and with that comes a higher likelihood of needing extended care. We're also seeing more cases of cognitive decline, which increases the need for long-term support. But here's the key point. Medicare hasn't changed much in this area. The misunderstanding is not new, but the financial impact is becoming more significant because people are needing care for longer periods of time and they're not always prepared for it. And this ties directly into a question I get all the time. It's this: My mom is going into rehab after a hospital stay. How long will Medicare pay? And the answer is, it depends. If she qualifies for skilled nursing care and continues to show improvement, coverage can last up to 100 days, but that is not guaranteed. In the moment care shifts from rehabilitation to daily living assistance, Medicare coverage stops. And that's why families need clarity before they're even in this situation. So, what's the takeaway here? Let's go back to the hotel scenario. The problem wasn't the hotel. The problem was assuming the stay could continue under the same conditions. And that's what happens with Medicare. Again, people assume it will cover long-term care, and it doesn't. So here's the preventable problem for this week. Believing Medicare is long-term care insurance. It is not. Here's your action step. Have the conversation before you need it. Understand what Medicare covers, what it does not, what your potential financial exposure could be, and whether long-term care planning should be a part of your overall strategy. Because once rehab ends, the rate changes. And that is not the time to start planning. And that's why this matters. We know Medicare can feel complicated, but it does not have to be confusing. Until next time, stay informed, stay prepared, and I will see you on the next episode of Medicare Unscripted.